So, good morning to all of you. I'm very happy to be here today. I'm Germana. I'm a physician, but I'm not an orthopedic surgeon. I'm responsible for the strategic planning of the National Institute of Traumatology and Orthopedics. And I'm very happy to tell a little bit how we see safety and how we are trying to consolidate safety culture in the orthopedic surgical environment. So INTO is a national orthopedic center in Rio de Janeiro, and we have 321 beds and 21 operating rooms. And we are a teaching hospital certified by the Joint Commission International, and also we are a member of ISOC. I don't know if you know ISOC. It's the International Society of Orthopedic Centers, a society that congregates 19 of the best orthopedic centers in the world. We are responsible for doing highly complex surgeries, and last year we did 9,652 surgeries. So why is that it's so important for us, safety? Because we work with high complexity, and complexity brings more probability of errors. The development of the technology made it possible for highly complex surgeries to become routine. But at the same time, more errors began to occur. That's what's happening today. So orthopedics and traumatology is a specialty very prone to error because we work with high complexity, we have a high number of different procedures, we are very dependent on technology, we work with lots of variables, most of them don't depend on the surgeon, and also teamwork and communication are very important. So orthopedics and traumatology is very prone to error. The National Health System in England, they did a research in 2011 where they found out that almost 30% of all the litigation cases were due to orthopedic errors. That's very important. And that happens not only in England, but everywhere. If we can see in the news, in the media, television, errors keep happening all over the world, not just in England, in Brazil, in the US, everywhere. I think maybe because of the bilateralism, as Mary said, we have two arms, we have two legs, so it's easier for mistakes to happen. So errors keep happening. Cyril told us that healthcare is not safe. Let me see how it works for the pointer. So as we see here, if we take civil aviation, we have to have more than 100,000 encounters for a fatality, for a death. And if we see healthcare here, with 600, we have a death. So healthcare is very unsafe. The Joint Commission did a research for 15 years just in the certified hospitals, and they find out a lot of mistakes, almost 7,000. And most of the mistakes were due to procedures in wrong patients or in wrong body parts. So, here. Why is that so many errors occur? One could think it was due to imprudence, negligence, or lack of skills. But these two Brazilian authors, they did a research in 2009 where they find out that 95% were due to process failure. And most important than that is that in our research, 67% of these errors were avoidable. That's very important. So we could make a comparison between healthcare and civil aviation. As we saw in the graphic before, civil aviation is also very risky. I'm very afraid of flying, to tell you the truth. I don't like to fly, but not so many accidents happen. Why? They also work with high complexity. They are very dependent on technology. They have lots of variables, and most of the variables, they don't depend on the ability of the pilot. They also need teamwork and communication, and not so many accidents occur. It would be even better to compare civil aviation with the surgical environment, because the OR, the operation room, is like the cockpit. Lots of variables, they don't depend on the surgeon or the pilot. So Why is that not so many errors occur in civil aviation? I think the key answer is risk management. They do manage risk. Yeah? They map risk, they anticipate risk, they have a lot of safety barriers, and they systematically use checklists. They have well-defined contingency plans, they have an efficient communication, and most important of all, they learn from their mistakes. I think this is very important. And this is called, as Cyril said, a safety culture. Then we can deduce that a culture of safety minimizes the occurrence of errors. So what is a safety culture? A safety culture takes on account, first and most important of all, the existence of risk. The risk is always there, and it doesn't depend on the ability of the surgeon. That's, for me, this is the most important thing. You have to consider the risk. Then the flexibility and the contingency plans. You have to know if something went wrong. You have to know the plan B and the plan C. You have to know this. You have to use systematically checklists and barriers and safety barriers. And this is very difficult in healthcare. You have to notificate your errors because then you're going to learn. In healthcare, it's very difficult because for doctors and nurses to speak up when they do something wrong, it's difficult because then they are afraid of the litigation cases. So it needs a change of culture. Historically speaking, there are many initiatives to improve surgical safety. I'm just going to tell a little bit about the most important. The first one was one from the Canadian Orthopaedic Association in '94 called Operate Through Your Initials. And then in '97, the AAOS launched the initiative Sign Your Site. And in 2000, the Institute of Medicine published the document called To Where is Human, which was very important because it called attention from the media, from doctors, from patients, and everybody began to talk about safety. The World Health Organization launched an initiative called World Alliance for Patient Safety in 2004, where it stated global challenges. And the second global challenge was called Safe Surgery Saves Lives in 2007, and Brazil joined this alliance in 2008. In 2009, the Brazilian government published a document, a manual, Safe Surgery Saves Lives, where they asked people to do the checklist, that checklist that was shown before. So the checklist proposes 3 moments. The first one is called the sign-in before anesthesia. The second one is the timeout. And the third one, the sign-out before the patient leaves the room. So in the timeout, it is very important that the team introduce themselves, because it's not like in the Mayo Clinic. There is not a team. People, they work together, but they don't know each other. So it's very important when you introduce yourself, because first you make a bond, and then if you have an experience or an expertise that can be helpful if an accident happens, it's very important too. So this is supposed to be done in every surgical environment. But it didn't happen so easy in Brazil. Not only in Brazil, the AAOS in 2009 did a research, and they found out that 53% of the orthopedic surgeons had an incident in the last 6 months. The Brazilian Society of Orthopaedics and Traumatology did a research in 2012, and they found out that almost 41% of the orthopedic surgeons had an incident, and more important than that, that's very important, that 65% of the orthopedic surgeons, they were not aware of the WHO safety surgical protocol. This is very important, very, very important for us. This was the research that was made and ended up by an article that was published in the RBO, which is the orthopedic magazine, in 2013. So the Brazilian government decided to launch another initiative called National Program for Patient Safety. And among other things, they wanted to implement the WHO protocol in all hospitals. So the main question is, why it is so easy for pilots to use the checklist, and surgeons, they do refuse to do it? They have so many resistance doing that. Are surgeons overconfident? Are surgeons more believing? They do believe in God more than pilots. Do they think that fatalities never occur to them? I think the right answer for that is that if the plane crashes, the pilot dies. That's very simple. And that's the point. And also, because of this answer, we talk that we have to convince surgeons that the risk is there, that the risk exists, because that makes pilots do everything. And that's why planes don't crash every day. I'm very thankful to them because, I'm very afraid. But then, just to end my presentation, this is a very famous case. It has been studied in all management schools. It's the case of the US Airways Flight 1549. I think everybody here remembers this case. It was an Airbus leaving LaGuardia heading to Charlotte. And then 2 Canadian goods, they entered the turbines, and the turbines stopped. So they have to make an emergency landing, and no airports could handle that emergency, so they had to land on the Hudson River. And very interesting was that the pilots, they didn't know themselves before, but they did the timeout. They did the timeout, and they knew that the pilot was not an expert with Airbus, but the co-pilot was. So they changed place. And also, all the crew was very trained. They knew what to do. And so the plane landed, and nobody got hurt. It was very, very successful. That shows us that if you have a safety culture, and if an accident occurs, it can work. That was why this case has been presented. So, together with the Brazilian Orthopaedic Society, we are trying to use this campaign. It's called Consider the Risk, Mind the Risk. The logo means you can have a safe surgery if you consider the risk. That's the hand. It's very difficult to make surgeons believe in the risk, but we are trying to do that. This campaign started in 2012, and what we are trying to do, we are trying to change the perception of the risk, and by doing that, we are trying to minimize the risk by preconizing the systematically use of checklists, the communication improvement, and also to bring transparency and to make people learn from their mistakes.